Medical care-related diseases. Medical care-related diseases or HAI are contaminations you might contact in a medical care offices while you are getting therapy for an alternate condition. Microorganisms, for example, methicillin-safe Staphylococcus aureus, otherwise called MRSA. Enterococcus species and Clostridium difficile are as often as possible the reason for well-being-related disease. These diseases are a significant reason for death all throughout the planet. Perhaps the most widely recognized way these bacterial is passed from one individual to another is through absence of appropriate hand cleanliness. At the point when individuals don't perfect their hands, they can move microorganisms starting with one patient then onto the next or starting with one piece of the body then onto the next on a similar patient. There are 4 normal sorts of well-being-related diseases. A careful injury contamination could happen when microorganisms gets into your entry point and spread through your tissues prompting disease. A urinary plot contamination can happen when you have a catheter, Foley catheter, in your bladder, which is a cylinder used to deplete pee. Microscopic organisms can enter your urinary framework through the catheter, enabling the microorganisms to go into your bladder where they can develop. A circulatory system disease can happen when you have a focal line catheter, in your vein, which is a thin cylinder used to convey liquid or meds into a huge vein close to the heart. Microorganisms can enter through the skin around the inclusion site or straightforwardly into the circulation system where they would cause disease. Pneumonia could result when you are on a ventilator or a breathing machine. Microorganisms could enter your throat while you are being put on a ventilator. Then you might breathe in the microbes into your lungs, leading to disease and that could likewise cause pneumonia. Hand hygiene, a straightforward minimal expense and compelling procedure, is the absolute most significant strategy for forestalling medical services-related contaminations. Everybody in the medical services facilities, including patients, visitors and clinical personnel, could help to forestall these contaminations by cleaning their hands oftentimes. Hand cleanliness could be performed with cleanser and running water for 40 to 60 seconds or by completely scouring your hands with a liquor-based hand sanitizer for 20 to 30 seconds. In case you are getting well-being care, you are consequently essential for the medical services group and you ought to guarantee that everybody that comes into contact with you, cleans their hands.